Welcome to Dr. D YouTube channel. Today we'll discuss a very interesting topic in pediatrics, which is the developmental milestones. We have four domains in this developmental milestone, which is gross motor, fine motor, language, social behavior. These are the four main domains or headings under which development occurs. Okay, so let us first take about the gross motor development. Gross motor means very large movements in our body, not fine skills like holding grip on the grass movement, sitting, standing, holding, walking. These are all the grass movements. So the rule is development proceeds from cephalocaudal progression, that is from head to toe. The development starts through head, goes to neck, upper limb, trunk, hip, and this is the way the development occurs. First, we'll start from the neonate, from newborn up to infant, that is up to 1 year. First, we'll know what are all the milestone is achieved. Then we'll know about the timing of when they are achieved. So the first, as I discussed, it progresses cephalocaudally. Head control or neck holding will come. ಕತ್ತು ನಿಲ್ಲೋದು ಅಂತಾರೆ ಕನ್ನಡದಲ್ಲಿ. ಕತ್ತು ನೆಕ್ ಸ್ಟಿಫ್ನೆಸ್ ಇರಲ್ಲ, ಯಾವಾಗಲೂ ಹಿಂಗೆ ಹಿಂದಕ್ಕೆ ಹೋಗ್ತಾ ಇರುತ್ತೆ, ಆ ಕಡೆ ಹೋಗ್ತಾ ಇರುತ್ತೆ, ಈ ಕಡೆ ಹೋಗ್ತಾ ಇರುತ್ತೆ. ಸೊ ಹೆಡ್ ಕಂಟ್ರೋಲ್ ಆರ್ ನೆಕ್ ಹೋಲ್ಡಿಂಗ್ ಬರುತ್ತೆ. ದಟ್ ಈಸ್ ದ ಫಸ್ಟ್ gross motor milestone achieved by a baby, head control. Okay, then after the neck, the trunk comes. Trunk muscles will be controlled by the baby, and andre yade hotte, all the trunk muscles tries to turn around supine to prone. This is supine position. The baby turns itself, ಅಂದರೆ ಮಕ್ಕಳ ಏನಂತಾರೆ ಕನ್ನಡದಲ್ಲಿ ಮಕ್ಕಡೆ ಮಲ್ಕೊಳ್ಳೋದು ಅಂತಾರಲ್ಲ, ಫ್ರಮ್ ಸುಪೈನ್ ಪೊಸಿಷನ್ ಟು ಹೊಟ್ಟೆ ಮೇಲೆ ಮಕ್ಕಡೆ ಮಲ್ಕೊಳ್ಳೋದು. ಇಟ್ ರೋಲ್ ಮಾಡುತ್ತೆ, ನಾಟ್ ವಿತ್ ದ ಸಪೋರ್ಟ್ ಆಫ್ ಹ್ಯಾಂಡ್ಸ್, ವಿತೌಟ್ ದ ಸಪೋರ್ಟ್, ಇಟ್ ಜಸ್ಟ್ ರೋಲ್ಸ್ ಟು ದ ಅಪೋಸಿಟ್ ಸೈಡ್. ದಟ್ ಈಸ್ ದ ಸೆಕೆಂಡ್ ಮೈಲ್ಸ್ಟೋನ್. ಫಸ್ಟ್ ಈಸ್ ಹೆಡ್ ಕಂಟ್ರೋಲ್ ಆರ್ ನೆಕ್ ಸ್ಟಿಫ್, ನೆಕ್ ಹೋಲ್ಡಿಂಗ್. Second, the control comes to the trunk, so the rollover, rotation of the body from supine to prone position. It can be vice versa. After this, the muscle controls comes to hip and the lower limb. Okay, muscle comes to hip and the lower limb. No, I'm sorry. Before that, control comes to upper limb first. So this is head, neck, trunk. It comes to upper limb. So limb control, upper limb control will come. So the baby tries to sit with the support of hands, like this. See, these two are the hands, this is the ground. Baby sits with the support of, the neck is stiff, it can sit like this in a tripod position. So this is a tripod, right? In tripod position, this can sit. Next after this, lower back control. After the upper limb, lower back will get control. The baby can sit without support of hands. Without the support of hands, it can sit erect. Okay, then after this, crawling. ಹೊಟ್ಟೆ ಮೇಲೆ ತೆಳ್ಕೊಂಡು ಹೋಗೋದು, ಅಂದರೆ like this. Baby is still on the ground. The abdomen is still touching the ground. He is holding he is holding his body with the support of hand. His neck is stiff and he is going forward like this. ಈ ಥರ ತೆಳ್ಕೊಂಡು ಹೊಟ್ಟೆ ಮೇಲೆ ಮಾಡ್ಕೊಂಡು ವಿತ್ ದ ಸಪೋರ್ಟ್ ಆಫ್ ಹ್ಯಾಂಡ್ಸ್ ಮುಂದಕ್ಕೆ ಹೋಗ್ತಾನೆ, ಕ್ರೋಲ್ ಆಗ್ತಾನೆ. ದಿಸ್ ಇಸ್ ಕ್ರೋಲಿಂಗ್. ಓಕೆ, ಆಫ್ಟರ್ ದಟ್ ಹಿಪ್ ಕಂಟ್ರೋಲ್ ಬರುತ್ತೆ, ನೀ ಕಂಟ್ರೋಲ್ ಬರುತ್ತೆ. ಓಕೆ, ಅಂಬೆಗಾಲಲ್ಲಿ ಹೋಗೋದು, ಅಂಬೆಗಾಲಲ್ಲಿ ನಡೆಯೋದು ಅಂತಾರಲ್ಲ, ಇಟ್ ಈಸ್ ಕಾಲ್ಡ್ ಎಸ್ ಕ್ರೀಪಿಂಗ್. ಈ ಥರ ಹೋಗೋದು ಕ್ರಾಲಿಂಗ್, ತೆಳ್ಕೊಂಡು ಹೋಗೋದನ್ನ ಕ್ರಾಲಿಂಗ್ ಅಂತಾರೆ. ಅಂಬೆಗಾಲು, ದಿಸ್ ಈಸ್ ಅಂಬೆಗಾಲು. write the diagram. So this is ಅಂಬೆಗಾಲು. ಈ ಥರ ಹೋಗೋದು ಕ್ರೀಪಿಂಗ್. ನೆಕ್ಸ್ಟ್ ಮೂವಿಂಗ್ ಟುವರ್ಡ್ಸ್ ಸೈಡ್ ಆಫ್ ಸಪೋರ್ಟ್ ವೈಲ್ ಸ್ಟ್ಯಾಂಡಿಂಗ್ ವಿತ್ ದ ಸಪೋರ್ಟ್. ಅಂದರೆ ಹಿಂಗೆ ಚೇರ್ ಇದೆ ಅಂದರೆ, ಓಕೆ, ಚೇರ್ ಇದೆ, ಇಲ್ಲಿ ಕೈ ಹಿಡ್ಕೊಂಡಿದ್ದಾನೆ, ಬೇಬಿ ಇಲ್ಲಿದೆ, ನಿಂತಿದೆ, ವಿತ್ ದ ಸಪೋರ್ಟ್ ಆಫ್ ಚೇರ್ ಈ ಕಡೆ ಸೈಡಿಗೆ ಹೋಗ್ತಾನೆ. ಹಿ ಈಸ್ ಗೋಯಿಂಗ್ ಮೂವಿಂಗ್ ಅ ಸೈಡ್ ಆಫ್ ಸಪೋರ್ಟ್ ವೈಲ್ ಸ್ಟ್ಯಾಂಡಿಂಗ್ ವಿತ್ ಸಪೋರ್ಟ್. Moving towards the side of support while standing with the support. So this is called cruising. So we discussed about the 3 C's. ಒಂದು ತೆಳ್ಕೊಂಡು ಹೋಗೋದು ಕ್ರೀಪಿಂಗು, ತೆಳ್ಕೊಂಡು ಹೋಗೋದು ಕ್ರಾಲಿಂಗು, ನೆಕ್ಸ್ಟ್ ಅಂಬೆಗಾಲಲ್ಲಿ ನಡೆಯೋದು ಕ್ರೀಪಿಂಗು, ಸಪೋರ್ಟ್ ಇಟ್ಕೊಂಡು ನಡೆಯೋದು ಕ್ರೂಸಿಂಗ್. ಸೊ ಡೋಂಟ್ ಕನ್ಫ್ಯೂಸ್ ವಿತ್ ದಿಸ್ 3C. 3C's ಬಂದ್ಬಿಟ್ಟು ಫಸ್ಟು ಎಲ್ಲದರಲ್ಲೂ ಆರ್ ಬರುತ್ತೆ, ಸಿ ಆರ್ ಬರುತ್ತೆ. ವಿಚ್ ಕಮ್ಸ್ ಫಸ್ಟ್? ABCD EF GH HIJK LMNO PQRS TUW XYZ. So A comes first, then E comes next, U comes last. ಹಿಂಗೆ ನೆನ್ಪಿಟ್ಕೊ. CR ಕಾಮನ್ನು, ಅದರಲ್ಲಿ A ಫಸ್ಟ್ ಬರುತ್ತೆ, E ನೆಕ್ಸ್ಟ್ ಬರುತ್ತೆ, U ಲಾಸ್ಟಿಗೆ ಬರುತ್ತೆ. CRA ಅಂದರೆ ಕ್ರಾಲಿಂಗ್, E ಅಂದರೆ ಕ್ರೀಪಿಂಗ್, U ಅಂದರೆ ಕ್ರೂಸಿಂಗ್. ಸೊ ದಿಸ್ ಇಸ್ ದ ನ್ಯೂಮೋನಿ. ಕ್ರಾಲಿಂಗ್ ಅಂದರೆ ತೆಳ್ಕೊಂಡು ನಡೆಯೋದು, ಕ್ರೀಪಿಂಗ್ ಅಂದರೆ ಅಂಬೆಗಾಲಲ್ಲಿ ನಡೆಯೋದು, ಕ್ರೂಸಿಂಗ್ ಅಂದರೆ ಸಪೋರ್ಟ್ ಇಟ್ಕೊಂಡು ನಡೆಯೋದು. ನೆಕ್ಸ್ಟ್ ಫೈನಲಿ ಏನು ಮಾಡ್ತಾನೆ, 1 ವರ್ಷ ಆಗಷ್ಟೊತ್ತಿಗೆ ಈ ಸ್ಟ್ಯಾಂಡ್ಸ್ ವಿತೌಟ್ ಸಪೋರ್ಟ್ ಬಟ್ ವಾಕ್ ವಿತ್ ಸಪೋರ್ಟ್. ನಿಂತ್ಕೊಂತಾನಷ್ಟೇ ವಿತೌಟ್ ಸಪೋರ್ಟ್, ಬಟ್ ಹಿ ವಾಕ್ಸ್ ವಿತ್ ದ ಸಪೋರ್ಟ್. ಓಕೆ, ದಿಸ್ ಈಸ್ ಅಬೌಟ್ ದ ಡೆವಲಪ್ಮೆಂಟಲ್ ಮೈಲ್ಸ್ಟೋನ್ ಅಪ್ ಟು 1 year. So if I brief you from cephalocaudal progression, first head control or neck holding, then trunk control. So he'll roll over, then he gets the control to his upper limbs. So he sits in tripod position, then the control comes to the lower back and hip, so he can sit erect. After that 3 C's, CR. So A comes first, CRA crawling, ತೆಳ್ಕೊಂಡು ಹೋಗೋದು. ನೆಕ್ಸ್ಟ್ CRE ಕ್ರೀಪಿಂಗ್, ಅಂಬೆಗಾಲ ನಡೆಯೋದು. CRU ಕ್ರೂಸಿಂಗ್, ವಾಕಿಂಗ್ ವಿತ್ ದ ಸಪೋರ್ಟ್. ದೆನ್ ಸ್ಟ್ಯಾಂಡ್ ವಿತೌಟ್ ದ ಸಪೋರ್ಟ್, ಸ್ಟ್ಯಾಂಡಿಂಗ್ ವಿತ್ ದ ಸಪೋರ್ಟ್, ಸ್ಟ್ಯಾಂಡ್ ವಿತೌಟ್ ದ ಸಪೋರ್ಟ್, ಬಟ್ he will walk with the support. So this is about the milestones. Now if we come to the duration, so the first milestone, that is head control, comes in 3 months. 3 ತಿಂಗಳಿಗೆ ಬರುತ್ತೆ. So now for this add 2 months, approximately 5 months. Okay, for the duration can be variable, 4 to 6 months, but the average is 5 months. For this lowest value 4 to 6, add plus 2, 6 months. The third milestone is 6 months, that is sitting in tripod position. For this 6 months, when he sits in tripod position, add again 2 months. So in 8 months he can start crawling. In 8 months. Add again 2 months for this 8 months crawling. So he can start creeping in 10 months. Again after this, add 1 month in last 2 months. Add 1 month for creeping. He can start cruising 11th month. Add 1 month for this cruising. He can stand without support in 1 year. Okay, if I revise you, if you start from 3 months, okay, 3 plus 2, 5, that is 4 to 6 is the average. If you add plus 2 to 4, you will get 6 months, plus 2 8 months, plus 2 10 months, plus 1 11 months, plus 1 12 months. So how many milestones are there? 1 2 3 4 5 6 7 milestones are there in first 1 year. What is the first milestone? Head control. Second head control, so neck holding. Second control is the trunk control, roll over. Then upper limb control, tripod sitting position. Lower back control and hip control. He can sit without support. Erect, he can sit erect. Then I think, yeah, 6 months. Along with this, sit with support. Along with this, crawling is also present in this 8 months. So get 2 CR, a crawling in 8 months, creeping in 10th month, cruising in 11th month, stand without support in 12th month. We'll get 2 milestone in the 8th month approximately. Crawling one. So this is about the developmental milestone up to 1 year. Then if you see after 1 year, he is able to stand without support. Now after 1 year, the same pattern of duration, that is 1 year plus 3 months, again 1 year plus 6 months, again directly go to 2 years. Okay, so 1 plus 3 months, 3 into 2, 3 into 2 6 months, 6 into 2 again 6 months, that completes 1 year after 12 months, that is 2 years. Okay, this is about the, again 1 year into 2, 3 years. Like this you should add like this: 1 year plus 3 months, add the same thing, plus 3 months is equal to 1 year plus 6 months, add the same thing, 1 year plus 6 months is equal to 12 months, that is 2 years. 1 plus 1 year, 1 plus 1 year, again plus add 1 more year, that is 3 year. So it is like this, the duration is like this after 1 year. So if you see the milestones, he can walk independently without support. In 1 year he can stand independently without support but walk with support. In 1 year 13 months he can walk independently without support, and he can creep upstairs. ಅಂಬೆಗಾಲ್ ಹತ್ಕೊಂಡು ಮೆಟ್ಲು ಹತ್ಕೊಂಡು ಹೋಗ್ಬೋದು ಅಂಬೆಗಾಲಲ್ಲಿ. he can creep upstairs 1 step above. Then in 1 year plus 6 months, that is 18 months, he can start running. He can able to walk in 1 year 3 months, he can be able to run in 1 year 6 months. 3 ತಿಂಗಳಿಗೆ ಓಡ್ತಾನೆ, goes upstairs by holding side ಸಪೋರ್ಟ್ ಇಟ್ಕೊಂಡು ಹತ್ಕೊಂಡು ಹೋಗ್ಬೋದು. ದೆನ್ ಇನ್ನೊಂದು 6 ತಿಂಗಳು ಬಿಟ್ಟರೆ ಹತ್ತುತ್ತಾನೆ. ಫಸ್ಟ್ ನಡೀತಾನೆ, ಆಮೇಲೆ ಓಡ್ತಾನೆ, ಆಮೇಲೆ ಹತ್ತುತ್ತಾನೆ. ಕ್ಲೈಂಬಿಂಗ್ ಸ್ಟೇರ್ಸ್ 2 foot 1 step, ಅಂದರೆ ಎರಡು ಕಾಲು ಒಟ್ಟಿಗೆ ಇಟ್ಟು ಹತ್ತೋದು. ಈಗ ಸ್ಟೆಪ್ ಇದೆ ಅಂದರೆ ಹತ್ತುತ್ತಾನೆ, ಇದನ್ನು ಇಡ್ತಾನೆ, ನೆಕ್ಸ್ಟು ಲೆಫ್ಟು ರೈಟು, ನೆಕ್ಸ್ಟ್ ಲೆಫ್ಟು ರೈಟು, ಹೀಗೆ ಎರಡು ಒಟ್ಟಿಗೆ ಇಟ್ಟು ಆಮೇಲೆ ಮುಂದಕ್ಕೆ ಹೋಗ್ತಾನೆ. ನಮ್ಮ ಥರ ನಾವು ಹೆಂಗೆ ಇಡ್ತೀವಿ, ಲೆಫ್ಟು ರೈಟು ಹಿಂಗಿದ್ರೆ ಲೆಫ್ಟ್ ರೈಟ್ ಈ ಥರ ಹತ್ಕೊಂಡು ಹೋಗ್ತೀವಿ. ಅವ್ರದ್ದು ಹಂಗಲ್ಲ, ಲೆಫ್ಟ್ ರೈಟ್. ದಿಸ್ ಈಸ್ 2 foot 1 step ಕ್ಲೈಂಬಿಂಗ್. ಓಕೆ, ದಿಸ್ ಈಸ್ ದ ಆ್ಯಂಡ್ ಕ್ಯಾನ್ ವಾಕ್ ಬ್ಯಾಕ್ ಗ್ರೌಂಡ್, ಹಿಂದಕ್ಕೆ ನಡಿಬೋದು ಅವನು. ಇನ್ 3 years he can climb upstairs with 1 foot 1 step, but downstairs with 2 feet 1 step. ಓಕೆ, ಹತ್ತುತ್ತಾನೆ ಅಂದರೆ ಹಿಂಗೆ 1 2 ಲೆಫ್ಟು ರೈಟು ಹಿಂಗೆ ಹತ್ತುತ್ತಾನೆ, ಬಟ್ ಇಳಿಯೋಕ್ಕಾಗಲ್ಲ. ಲೆಫ್ಟ್ ರೈಟ್. ದಿಸ್ ಈಸ್ ಹೌ come down, step down. Okay, this is in the 3 years. Then if you come, then he can ride tricycle ಕೊಡಿಸ್ತೀರ ಗೊತ್ತಾ, like this, something like this. ಆಟಾಡಕ್ಕೆ ಕೊಡಿಸ್ತಾರೆ ಎಲ್ಲರೂ, ಈ ಪೆಡಲ್ ಇರುತ್ತೆ. ಸೊ he can ride tricycle in 3 years. So 3 for 3 years, 3 wheel tricycle. Okay, tricycle in 3 years. Then in 4 years he can go downstairs also with 1 foot 1 step. Along with that he can stand with 1 leg. He can jump with 1 leg, hopping. ಕುಟ್ಟೆಬೆಲ್ಲ ಆಡ್ಬೋದು 4 ವರ್ಷಕ್ಕೆ. ಓಕೆನಾ, ದಿಸ್ ಈಸ್ ಆಫ್ಟರ್ 1 year. So if you see the developmental milestone after 1 year up to 4 years, 1 year ತನಕ ಭಾಳ ಡೆವಲಪ್ಮೆಂಟ್ ತುಂಬ ಮೈಲ್ಸ್ಟೋನ್ಸ್ ಆಗುತ್ತೆ, ಆಲ್ಮೋಸ್ಟ್ 7 to 8 ಮೈಲ್ಸ್ಟೋನ್ಸ್ ಆಗುತ್ತೆ. ಅದಾದಮೇಲೆ ಫ್ರಮ್ 1 year to 4 year you will see only 4 to 6 milestones. That is in 1 year. First, in 1 year ಏನಾಗಿರುತ್ತೆ, he can be able to stand with support but can't walk with support. After that he can walk with support and can creep upstairs. After that he can walk, after he walk without support, then he can run and goes to upstairs with holding the side risings. Okay, then he can, after that he can climb upstairs without support but with 2 foot 1 step pattern, and can walk back down. Then after that he can climb upstairs with 1 foot 1 step but downstairs with 2 feet. Then after that along with that he can ride tricycle. He can go downstairs also with 1 foot per step. Then he is able to stand with one leg and also can jump with one leg, which is called as hopping, which is achieved in the 4 years. This is about the gross motor milestones. Next we'll come to fine motor milestones. Okay, if you come to fine motor milestone, you can grasp the objects, which is called as drawing skill. He can first he'll grasp the objects. He can grasp the objects. He'll get the drawing skills. Then he'll get the dressing skills. Then he can make towers. This is the order where the fine motor milestone can occur. That is, grasping the object is the first thing, drawing skills is the second thing, dressing skills is the third thing, making tower out of cube is the fourth thing. You should look after this. Okay, we will discuss about the months and duration later. Let us see the milestones. Fine motors are absent in 0 to 3 months. The development starts from 3 months. Even the gross motor and even in fine motor up to 3 months nothing is there. Fine motor is absent because baby's hand is always closed due to neonatal palmar grasp. So what is this neonatal palmar grasp? If you give a finger to the baby's hand, it will grasp your finger very tightly. It is a reflex, it doesn't leave. If you give any object, it will hold like that. So it is called as palmar grasp reflex. It will be present up to 3 months. It is involuntary reflex. So fine motor is absent. It cannot hold any object voluntarily up to 3 months. So from 3 months or 4 months, the palmar grasp reflex disappears. From 4 months, the palmar grasp reflex disappears. Baby can open the hand and start reaching out for the object. They grasp object with both the hands. Support ಸಿಗ್ತಾ ಇರಲ್ಲ, like this. They'll with both the hands they'll try to grasp the objects without using the fingers. Okay, they'll use whole hand to hold the object. It is called as bidextrous grasping. Dextrous means hand, bi means two hand grasping is called bidextrous grasping. After that, from 6 months he can grasp with one hand but does not use the fingers. Which is also called unidextrous. Uni means one hand grasping, which is ulnar grasping. He uses his ulnar side. So if this is hand, this is radial side, this is ulnar side. The baby uses this ulnar side to grasp the objects. Then the radial or mature palmar grasp. After that, he will know that he can hold it in the radial side. Okay, with the help of thumb and remaining fingers. So this is radial. This comes next. So bidextrous and unidextrous immature, that is ulnar grasping. Unidextrous mature, that is radial grasping. They grasp with fingers. After this, they will know that they can use their fingers to grasp the object which is called as pincer grasping. In pincer grasping, you will get immature pincer grasping followed by mature pincer grasping. In immature pincer grasping, the baby holds any object with the side of fingers, like this, the side of finger. In mature pincer grasping, they can hold the objects with the tip of the finger, like this. This is the tip, this is the side. Okay, you clearly see in this picture. After this 15 months, now the child can hold pen or pencil. See, there is a grip. He can hold the object with his finger. It is needed to hold any pen or pencil, right? Now he can start scribbling by holding pen or pencil, anything. He just scribbles. Okay, then he follows the pattern like L. First he draws vertical line. He can draw vertical line. Then he can draw horizontal line. Then after that he developed to draw different shapes, which is circle followed by X or cross or plus. It can be plus, it is also a cross, square, triangle, diamond. Okay, these are all the shapes, drawing skills. After grasping, these are all the scribbling skills. After that, dressing skill, which comes dressing skills. He can undress first. He learns to undress. Patela bichaktan first. Then he learns to dress. But both this activity, undressing requires help. Okay. After this, he can undress without help. So this is about the dressing skill. Next, if we come to making of towers, it just follows 2 cubes. You can arrange 2 cubes, you can arrange 3 cubes, 6 cubes, 9 cubes. You can build a, what is this? I can't see this. Okay, let me see. You can build a bridge like this. Sorry, like this. You can build a bridge with blocks. You can build gate with blocks. So this is gate with blocks. Okay, this is about the fine motor milestones. Let us revise the fine motor milestones. As we discussed, it has 4 parts: grasping the object, drawing skills, dressing skills, and make towers out of cubes. Okay, so up to 3 months he will be having the palmar grasp reflex. So there is no fine motor milestone achieved up to 3 months. From 3 to 4 months, the palmar grasp reflex vanishes. So the baby can open the hands and start reaching out for the object. Voluntarily he can reach out the object, and he can grasp the object with the help of both the hands without using fingers. But he will not use the fingers. He will use the ulnar side of both the hands to hold or grasp the object, which is called the bidextrous grasping. Followed by, he can hold the object with one hand but without using the fingers. And still, in that unidextrous holding, there are 2 types. That is immature, where he holds the object in ulnar side of the hand, and are followed by mature grasping, mature palmar grasping, where he holds the object with radial side of the hand, which is where he'll know that he can use his thumb and remaining 4 fingers together. That is the radial or mature. Then he'll get to know that he can hold the object just by his fingers. That is called a pincer grasp. But he don't know to use the tip of the finger. First he'll use the sides, as he was using in palmar grasping, where his side of the radial side was used, side of the fingers was used. He continues to assume that he can only hold with the side of the fingers. So he'll first hold it with the side of finger, which is called as immature pincer grasping, followed by mature pincer grasping. Mature pincer grasping, that he holds the object with the tip of the finger. Now after you can use the tip, he can hold pencil or pen, he can start scribbling, then he draws vertical line, then he draws horizontal line, he draws different shapes like circle, cross or plus, square, triangle, diamond shape. Then after this grasping and drawing skills, he'll get the dressing skills. First he'll learn to undress with support. After that he'll learn to undress and dress without support. Then he'll learn to make the cubes out of cubes. He'll start with 2 cubes, 3 cubes, 6 cubes, 9 cubes, then followed by building a bridge with blocks, building a gate with blocks. These are all the fine motor milestones. If we come to the age, so up to 3 months nothing, from 4 months bidextrous, from 6 months similar to the grass motor. After 4 months add 2 months, so 6 months unidextrous. In 8 months, you will get mature palmar grasp. Add 1 month, 9 month immature pincer grasp. But here directly add 3 months, that is in 1 year he can hold mature pincer grasping. Okay, after that 1 plus 3 years scribbling, 1 plus 6 months years the vertical line, then 2 years horizontal line. So in 3 years you can see here the mnemonics, you can complete the circle in 3 like this, so it gives a circle, you can draw circle. In 4th year, see there is a plus or cross mark in this, so he can draw cross or plus mark. In 5 years you can join these two lines in 5 to form a triangle. In 6 to 7 year he draws a diamond. After that, in this about the dressing skill, 2 3 5, in 2 years undresses, 3 years dresses with skills, 5 years both without help. This is similar, 1 plus 3 years, 1 plus 6 years, 2 years, 3 years, 4 years, 5 years. This is about the age. So if you come to the third thing, language milestones. First, in 3 months, everything starts from 3 months. He starts musical sounds when our child feels happy. He starts giving musical sound. This is cooing sound. Okay, he starts giving cooing sound by 3 months. Then in 4 months, after 1 month, he starts to laugh aloud. This is laughing aloud. Then monosyllables. After laughing, he can speak monosyllables. Ma, pa, ma, ba. These are the monosyllables. Then after that, he can speak bisyllables. Mama, papa, baba, la la, wa wa. These are the bisyllables, mama and papa. 1 to 2 words. After that, he can speak just 1 or 2 words with meaning. Like very few. On here, bo bo, nai. So like this. Appa. He know about appa, amma. With meaning, tata. So these are the bisyllables with meaning in 1 year. Again, in 1 plus 3 years, he can speak few words without meaning, which is called as jargon speech. It is not clear here. I'll write it for you. Jargon speech. That is approximately after 1 year, 1 year plus 3 months, the child starts speaking some bullshit words without meaning. He keeps on talking like that, which is very temporary for up to 2 to 3 months. Few words he'll be talking where there is no meaning. After that, it vanishes to form 8 to 10 words of speech with meaning. Then he can speak 100 words and start to speak in sentences in 2 years. He starts to make sentences in 2 years. In 3 years, he can recognize and tell the name, age, gender. In 4 years, he can tell a story, a rhyme. In 5 years, he can ask the meaning of words. So, the 5 years, minimum 5 years, is the required age for a child to join pre-nursery or LKG. So you should complete 5 years. Okay, this is about the language milestone. Social milestone: in 2 months he learned to smile. Social smile, he'll simply smile. Then in 3 months he'll interact with the mother, that is called as mother regard. ಮದರ್ ರಿಗಾರ್ಡ್ ಅಂದರೆ ಅಮ್ಮನ ನೋಟಿಸ್ ಮಾಡ್ತಾನೆ, ಅವ್ರಿಗೊಂಥರ ರಿಗಾರ್ಡು, ಫಸ್ಟ್ ಟೈಮ್ ಅಮ್ಮ ಅಂತ ಇದಕ್ಕೆ ಅನ್ನಿಸ್ತಿದೆ, ಮದರ್ ರಿಗಾರ್ಡ್. ಇನ್ 3 months ದೆನ್ ಸ್ಟಾರ್ಟ್ಸ್ ಕ್ರೈಯಿಂಗ್ ವೆನ್ ದ ಸಿ ಸ್ಟ್ರೇಂಜರ್ಸ್. ಅಮ್ಮನ ಮಾತ್ರ ನೋಡಿರ್ತಾರೆ, ಬೇರೆ ಯಾರು ಗೊತ್ತಿರೋಲ್ಲ, ಬೇರೆ ಯಾರನ್ನು ನೋಡಿದ್ರು ಅಳ್ತಿರುತ್ತೆ. ಇಟ್ ಈಸ್ ಕಾಲ್ಡ್ ಎ ಸ್ಟ್ರೇಂಜರ್ ಆ್ಯಂಗ್ಸೈಟಿ. ಸ್ಮೈಲ್ಸ್ ಅಟ್ ದ ಮಿರರ್, ಬಟ್ ತನ್ನಂತ ನೋಡಿಕೊಂಡ್ರೆ ಇದು ಯಾರಪ್ಪ, ಇದು ಚೆನ್ನಾಗಿದೆ ನನ್ನ ಥರನೇ ಅಂತ ಸ್ಮೈಲ್ ಮಾಡ್ಕೊಳುತ್ತೆ. ಮುಂಚೆ ಸುಮ್ಮನೆ ಸ್ಮೈಲ್ ಮಾಡಿ ಸೋಷಿಯಲ್ ಸ್ಮೈಲ್ ಯಾರು ಬಂದರು, ಆಮೇಲೆ ಅಮ್ಮನ ರೆಕಗ್ನೈಸ್ ಮಾಡಿದ್ಮೇಲೆ ಅಮ್ಮನೇ ಸರ್ವಸ್ವ ಆಗುತ್ತೆ, ಬೇರೆ ಯಾರು ನೋಡಿದ್ರೆ ತನ್ನಂತ ನೋಡಿಕೊಂಡ್ರೆ ಸ್ಮೈಲ್ ಮಾಡ್ಕೊಳುತ್ತೆ. ದೆನ್ ಇಟ್ ವೇವ್ಸ್ ಬಾಯ್ ವೇವ್ ಮಾಡುತ್ತೆ, ಹೋಗಿ ನೀವು ಯಾರು ಬೇಡ ಅಂತ. ಅದಾದಮೇಲೆ ಅದ್ರ ಪಾಡಿಗೆ ಅದು ಆಟ ಆಡ್ಕೊಳುತ್ತೆ. ಪ್ಲೇಯಿಂಗ್ ಸಿಂಪಲ್ ಬಾಲ್ ಗೇಮ್ಸ್ ಲೈಕ್ ಥ್ರೋಯಿಂಗ್ ಬಾಲ್ಸ್. ಸಣ್ಣ ಮಕ್ಕಳು ಕೂತ್ಕೊಂಡಿರುತ್ತೆ, ಎಸಿತಾ ಇರುತ್ತೆ, ನೋಡಿರ್ತಿರೋಲ್ಲ, ಲೈಕ್ ದಟ್. ದೆನ್ point to object, example, points to ball and ask for it. After one year he asks for it. Okay, ಬಾಲ್ ಸುಮ್ಮನೆ ಆ್ಯಕ್ಷನ್ ಮಾಡಿ ತೋರಿಸ್ತಾನೆ, ಬಾಲ್ ಕೊಡು ಅಂತ. ಇನ್ 18 months, that is 1 year 6 months, the child tries to imitate the activity that's the parents do, which is called as domestic ಮಿಮಿಕ್ರಿ. ಈಗ ಹೇಳ್ಕೊಡ್ತಿರ್ತಾರೆ ಅಪ್ಪ ಅಮ್ಮ ಏನಾದರೂ, ಹೆಂಗೆ ಮಾಡು, ಹಂಗೆ ಮಾಡು, ಇದು ಮಾಡು, ಬಾಯ್ ಮಾಡು, ಜಂಪ್ ಮಾಡು, ನಾನು ಹೇಳಿದ್ದು ಹೇಳು ಅಂತ. ಸೊ ಮಿಮಿಕ್ ಮಾಡಿಸ್ತಾರೆ ಅವರೇ. ಸೊ ದ ಚೈಲ್ಡ್ ಮಿಮಿಕ್ಸ್ ದ ಪೇರೆಂಟ್ಸ್, ವಿಚ್ ಈಸ್ ಕಾಲ್ಡ್ ಆಸ್ ಡೊಮೆಸ್ಟಿಕ್ ಮಿಮಿಕ್ರಿ. ನೆಕ್ಸ್ಟ್ ನಾನ್ ಇಂಟ್ರಾಕ್ಟಿವ್ ಆರ್ ಪ್ಯಾರಲಲ್ ಪ್ಲೇ. ಅದಷ್ಟಕ್ಕದು ಆಡ್ತಿರುತ್ತೆ, ಬೇರೆ ಪ್ಯಾರಲಲ್ ವರ್ಲ್ಡಲ್ಲ, ಅದೇನು ಡಿಫ್ರೆಂಟ್ ಪ್ಯಾರಲಲ್ ವರ್ಲ್ಡಲ್ಲಿರುತ್ತೆ, ಬೇರೆ ಗ್ರೂಪ್ ಜೊತೆ ಸೇರಲ್ಲ. ಅದಾದಮೇಲೆ ಇಂಟ್ರ್ಯಾಕ್ಟ್ ಮಾಡೋಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಆಗುತ್ತೆ. ಇಂಟ್ರಾಕ್ಟಿವ್ ಆರ್ ಗ್ರೂಪ್ ಪ್ಲೇ. ಗೋಸ್ ಟು ಟಾಯ್ಲೆಟ್ ಅಲೋನ್. 4 years ತನಕ ಹೋಗೋಕ್ಕೆ ಭಯ ಆಗ್ತಿರುತ್ತೆ, ಆಮೇಲೆ ಗೋಸ್ ಟು ಟಾಯ್ಲೆಟ್ ಅಲೋನ್. 5 years 3 follows 3-step commands. If you say go next to room, take a pen, come back and keep here, this is 3-step command. Follows 3-step command, then they'll do it. They'll identify 4 colors and repeat 4 digits. They'll identify 4 colors, they can identify, then they'll repeat the 4 digit if you teach them. Helps in household tasks and can undress on its own. Okay. Other milestone like mouthing. They straightly take the object to mouth and start. ಏನು ಸಿಕ್ಕರು ಬಾಯಿಗೆ ಇಟ್ಕೊಂತಿರ್ತಾರಲ್ಲ, that is called as mouthing. Starts from 6th month. Casting. If you give ball to baby, it will throw forcefully, willingly, repeat again, deliberate throwing of some. ಸುಮ್ಮನೆ ಎಸಿತಾ ಇರುತ್ತೆ, ಕೈ ಕೊಟ್ಟರೆ ನೋಡಿರ್ತಿರಲ್ಲ. ಇಟ್ ಬಿಗಿನ್ಸ್ ಬೈ 1 year till 18 months, 2 years. ಸಿಕ್ಕಿದ್ದೆಲ್ಲ ಮಕ್ಕಕ್ಕೆ ಎಸೆಯುತ್ತೆ, ಬಾಯಿಗೆ ಇಟ್ಕೊಳ್ಳುತ್ತೆ. ಇಟ್ ಈಸ್ ಕಾಲ್ಡ್ as casting. ಮೌಥಿಂಗ್ ಅಂದರೆ ಬಾಯಿಗೆ ಇಟ್ಕೊಳ್ಳೋದು, ಕ್ಯಾಸ್ಟಿಂಗ್ ಅಂದರೆ ಎಸೆಯೋದು. Object permanence. If a ball falls from hand and goes away, a 6-month child will think it has disappeared, whereas a child more than 9 months starts searching for that object, thinking that it is permanent, but not there in the field of vision. By 9 months, object permanence ಅಂದರೆ 9 ತಿಂಗಳ ತನಕ ಒಂದು ಆಬ್ಜೆಕ್ಟ್ ಕಣ್ಮುಂದೆ ಇದ್ದರೆ ಕಣ್ಮುಂದೆ ಇರೋದು ಮಾತ್ರ ಸತ್ಯ. ಕಣ್ಮುಂದೆ ಇರೋದು ಬಚ್ಚಿಟ್ಕೊಂಬಿಟ್ರೆ ಮುಗೀತು, ಆಬ್ಜೆಕ್ಟ್ ಇಲ್ಲ ಅಂತ ಅರ್ಥ. ಅದೇ ಆಫ್ಟರ್ 9 months ನೀನು ಬಚ್ಚಿಟ್ಕೊಂಡ್ರೆ ಗೊತ್ತಾಗುತ್ತೆ, ಬಚ್ಚಿಟ್ಕೊಂಡ್ರು ಇದಿಲ್ಲೇ ಎಲ್ಲೋ ಇರುತ್ತೆ ಅಂತ. ದ ಬೇಬಿ ಸ್ಟಾರ್ಟ್ ಸರ್ಚಿಂಗ್, ವಿಚ್ ಈಸ್ ಕಾಲ್ಡ್ as ಆಬ್ಜೆಕ್ಟ್ ಪರ್ಮನೆನ್ಸ್. ದೆನ್ ಹ್ಯಾಂಡೆಡ್ನೆಸ್. right-handed, left-handed. It starts from 3 years and firmly established by 4 years. Right-handed, left-handed. And hand regard. Child look and play with its own hand. Appears in 3 months and persists up to 5 months. If it persists more than 5 months, it is a developmental delay. Then vision ಗೆ ಬಂದರೆ binocular vision is established by 4 months. ಅಲ್ಲಿವರೆಗೂ ಯೂನಿಯಾಕ್ಯುಲರ್ ವಿಷನ್ ಇರುತ್ತೆ. ಫ್ರಮ್ newborn up to 45 degree, he can follow up to 45 degree. From 1 month he can follow object up to 90 degree. From 3 months up to 180 degree. So like this vision. So binocular vision is established. And hearing, newborn, they can't localize where the sound is from, but they respond to sound by jerking the body. That is startle response. ಯಾವುದೋ ಒಂದು ಸೌಂಡ್ ಬಂತು, ಎಲ್ಲಿಂದ ಬಂತು ಅಂತ ಗೊತ್ತಾಗಲ್ಲ, ಬಟ್ ಸೌಂಡ್ ಬರೋದು ಗೊತ್ತಾಗುತ್ತೆ, ನಡುಗುತ್ತೆ, ಬೆಚ್ಚಬೀಳುತ್ತೆ ಬೇಬಿಗಳು. ದಟ್ ಈಸ್ ಕಾಲ್ಡ್ ಎ ಸ್ಟಾರ್ಟಲ್. STARTLE, startle response. Startle response. Localization of sound. If you think here is a source of sound, the horizontal localization comes by 4 months, downward localization comes from 6 months, upward localization comes from 7 months, diagonal sound localization comes from 10th month. This is called as Murphy's sequence of sound localization. Murphy's sequence of localization. Okay, it is an important question. Murphy's sequence of localization. Then how will you assess the development? You can pull to sit maneuver. You can pull the baby by holding hands. If the head goes down, still head holding not achieved. In newborn it will be like that, head lag will be seen. After 3 months no head lag will be seen, that is the neck will be stiff like this if you pull the hand. Ventral suspension. If you hold the baby, the head and limbs drop down like this. See, it has dropped down. From 2 months the head at the level with the rest of the body. Head will be at the level of the rest of the body, straight irutte. 3 months head lifted above the level of body, ಈ ಥರ ಮೇಲಕ್ಕೆ ಹೋಗಿರುತ್ತೆ. ನೆಕ್ಸ್ಟ್ ಪ್ರೋನ್ ಪೊಸಿಷನ್. ನ್ಯೂಬೋರ್ನ್ legs folded, kept up to 2 weeks, beneath abdomen, pelvis lifted up. ಈ ಥರ ಇರುತ್ತೆ. 4 to 6 weeks legs are straight, pelvis at the level, rest of the body prone ಪೊಸಿಷನಲ್ಲಿ ಹೆಂಗೆ ಮಲಗ್ತಾವೋ ಅಂತ. ಓಕೆ, ಇನ್ 3 ಮಂತ್ಸಲ್ಲಿ ಹೆಡ್ ಲಿಫ್ಟ್ ಮಾಡ್ಬೋದು, ಎಲ್ಬೋ ಫ್ಲೆಕ್ಸ್ಡು. ಬೇರೆ 6 ಮಂತ್ಸಲ್ಲಿ ಟ್ರಿಪೋರ್ಟ್ ಪೊಸಿಷನ್ ಇರುತ್ತೆ, ಎಕ್ಸ್ಟೆಂಡ್ ಎಲ್ಬೋ ಸ್ಟ್ರೈಟ್ ಇರುತ್ತೆ, ಎಕ್ಸ್ಟೆನ್ಷನ್ ಬೇರಿಂಗ್ ಅಪ್ ಟು ದ ಎಕ್ಸ್ಟೆಂಡೆಡ್ ಲಿಮ್ಸ್. ದಿಸ್ ಆರ್ ಆಲ್ ದ examination. Okay, in developmental quotient, DQ, something like IQ, intelligent quotient ತರ developmental quotient ಇದೆ. So the developmental age divided by chronological age into 100. A 6-year-old boy can draw only circle. The developmental age of circle, as you discussed, 3 years. Okay, but his chronological age is 6 years. Can only draw circle, no triangle, no square. So 3 by 6 into 100 to 50%. So his developmental milestone is 50%. If the developmental quotient is less than 70, it is abnormal or developmental delay. How will you evaluate for a preterm baby? This is the age if the baby is delivered in term pregnancy. If it is a preterm baby, 32 weeks of gestation, the postnatal age will be 3 months, that is early by 3 months. So the normal term is 40 weeks. Gap is 40 minus 32, 8 weeks of gap or 2 months of gap. Corrected age is postnatal age minus the gap. This is the postnatal age is 3 months minus the gap is 2 months. So 1 month old according to development. Okay. This correction is done till 2 years, as 90% of brain development. Within that, not much difference after that. Okay, up to 2 years this age correction is done. Red flag signs in development. Immediately child has to look for underlying cause. If there is a visual fixation, head control, vocalization, sitting without support, standing with support, standing without support, walking without support, single word. Upper limit is 2 months, 5 months, 6 months, 10 months, 12 months, 18 months. Okay. So So then if we come to the screening, good doctor treats patient, not only the disease, you know this. Okay, good good enough Harris Dryman test. These are the screening test. Good enough Harris Dryman test, Denver 2 test, Trivandrum developmental screening, Fataks Baroda screening. This is the screening test. Definitive test. Barley 2 scale, Stanford Valley intelligence scale, Western intelligence scale, Vinland adaptive behavior scale 2. If we come to the disorders of development, you can know there is a developmental delay, congenital and acquired. So it can be chromosomal, genetic syndrome, Fragile X syndrome, Rett syndrome, congenital hypothyroidism, torch infection, trauma, meningitis, perineum. In acquired, you'll get trauma, meningitis, asphyxia. These are the reason for developmental delay. Variant developmental dissociation. Define developmental dissociation: variation in attainment of milestone between two or more domains. That is, all domains are normal except language. Isolated language delay due to hearing loss. It is called as developmental dissociation. Whereas developmental deviation, child developed milestone out of normal sequence. That is, in cerebral palsy, at 2 months itself, child starts rolling over without head control due to increased tone of extensor muscle. He skipped the developmental milestone. So the sequence is lost. This is called as development of deviation. That is, he deviates from the normal route. Regression, loss of previously attained milestone, seen in Rett syndrome, subacute sclerosing, panencephalitis, leukodermatosclerosis, sometimes in cerebral palsy. So these are the variants or definitions you have to know. So developmental dissociation, ಮೂರು ಇರುತ್ತೆ, ಒಂದಿರಲ್ಲ. ಡೆವಲಪ್ಮೆಂಟಲ್ ಡಿವಿಯೇಷನ್, ಸೀಕ್ವೆನ್ಸ್ ಕರೆಕ್ಟಾಗಿರಲ್ಲ. ಡೆವಲಪ್ಮೆಂಟಲ್ ರಿಗ್ರೆಷನ್ ಬಂದಿರೋದು ಹೋಗುತ್ತೆ. ಸೊ ಥ್ಯಾಂಕ್ ಯು.